So we continue talking about the muscles of the arm, and we are about to reach, honestly, the hardest part of the model anatomy. And I will, for you being here, I'm kind of giving you a heads up in relation to the exam. Really, this is the hardest part. Muscles of the forearm, flexors and extensors of the palm, of the hand and fingers. Okay? So this, I will try to give you some mnemonics, but I don't know how helpful they are. We're going to start with superficial muscles, and we're going to start with a muscle called pronator teres. Now, when you look at the arm right here, okay, the way I suggest students approach working with a model is that the first muscle that you identify no matter what is brachioradialis, which is right here in this big model, and it carries number 20. Can you see it? Number 20. My fingers, not my thumb, but my fingers are on it. And then you go, this direction is going to be what? If it's upright, it's going to be clockwise as you identify muscles. So the first muscle to identify is pronator teres, 12. Okay? You can see it right here. Pronator teres originates in the humerus and ulna and inserted into radius. If you would look at the arm or hand of Marvin, if something originates at ulna and is inserted into radius, contraction of that muscle will cause pronation. Does that make sense? Next muscle is flexor, number 13. Flexor carpi. Look at this. Carpi, right? Radialis. So the origin of that muscle actually is the humerus, and insertion is the base of metacarpals. Here it is, flexor carpi radialis. If you would think about it, if you would think what's going to happen when you pull on the flexor carpi radialis, look, if you pull on it, what's going to happen to your wrist? It's going to flex, right? It's going to flex because it's going to pull on the basis of two metacarpals. Why it is called radialis? Radius is the lateral muscle. Radius is the lateral bone. Flexor carpi radialis is the lateral muscle. Are we clear? So it runs laterally. Does that make sense? Next muscle, palmaris longus. You can see palmaris longus attached to the structure called palmar aponeurosis. On here, palmaris longus is cut on the model. It is number 14. And you see the ligament of palmaris longus running to the wrist and is cut right there. So palmar aponeurosis is gone. It's not there. But what does it do? Pull on palmaris longus. It also starts at the humerus, and what it's going to do? Huh? Flexion, right? Flexion of the entire palm. Now, very important detail that I want to highlight. All of those muscles yet, they start at the humerus. So they are very weak synergists in a flexion of an arm. Very weak, but they are. Does that make sense? Because if something is attached to the epicondyle of the humerus and is here, by contracting it, they will help the flexion, okay, in the elbow. The fourth muscle We're going to talk about pronator quadratus separately. The fourth muscle is flexor carpi ulnaris. Okay? So it runs from the humerus and ulna to the medial carpals and metacarpal. Flexor carpi ulnaris on this guy will be number 15. So you see it runs from the medial epicondyle. Flexor carpi ulnaris is right here. So it's the medial muscle 15. Pretty much runs along the medial border of your forearm. And flexor carpi ulnaris, together with flexor carpi radialis, innervated by the ulnar and radial nerve, they flex your forearm. Does that make sense? Now, before we move on to pronator quadratus, which I'm not sure if we can see it here. Let's not experiment on that model. I'll show it to you on the pic. So you see very deep muscle, pronator quadratus, to the right. Here. Can you see pronator quadratus? I'm going to highlight it as much as I can. So this is pronator quadratus. Okay? It connects distal ulna and distal radius. When it is contracted, it's the prime mover of pronation. Does that make sense? Now, muscles that can be seen on this model, I'm going to give you a little bit of a mnemonic. It may help. You start from here. On the model, it's number 12. Look at the first letters of the name. Pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. PF, PF. Does that make sense? Pass, fail, pass, fail. Pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Is that good? Now, another thing. If something points at the forearm, there are two types of muscles that you're going to see. Pronator muscles and flexor muscles. There will be no extensors. Am I clear? So if you have one of the answers, if something points here, and one of the answers is extensor, you can ditch it right away. Deep flexor muscles. Flexor digitorum. So you have flexor digitorum superficialis, okay, with origin in the humerus and insertion point in the phalanges, which flexes fingers. Go ahead.
I just have a question about the extensor carpi radialis longus. Is that
Extensor or flexor? Oh, extensor. Okay.
Is that part? Is that like the exception, or is that just like part of this side of the arm?
Extensor carpi radialis longus. It will be right here.
Okay, so it's not.
No, right here, right here. No, it's the posterior aspect of your forearm.
Okay.
It's totally different muscle. Does that make sense?
Yeah.
So this one,
Right.
it's like it. We're gonna see the better view of it.
Okay.
Okay. Sorry. So you have flexor digitorum superficialis and flexor digitorum profundus. Superficialis means superficial. Profundus means deep. Okay? So this muscle, flexor digitorum superficialis, is superficial to flexor digitorum profundus. Okay? Superficialis originates in the humerus, profundus originates at ulna. They all are inserted into the phalanges. Superficialis in the proximal, profundus is in the distal. Okay, you can see that. And these two muscles, you can see them working. If you flex your fingers, you can see them working in your forearm. Does that make sense? Then there is a muscle called flexor pollicis longus. Let me erase this so you can see it. So you can see pretty large flexor pollicis longus. That's the muscle that allows you to flex your thumb. Pollicis means thumb. It starts at the radius and inserts into the distal phalanx number 1. Okay? Does that make sense? To your question, extensors. Now, extensors you can see like 4 or 5E. All muscles of the posterior aspect of the forearm are extensors. And we're going to start with extensor radialis, longus, and brevis. They are immediately next to the brachioradialis. 19 here, extensor carpi radialis longus, and 18 is extensor carpi radialis brevis. Here, can you see that? I almost finished. Huh? So 19 and 18. 19 is extensor carpi radialis longus, and 18 is extensor carpi radialis brevis. Okay? Then you have large muscle, which is called extensor digitorum. You can see it right here, it's 17. And on the model, you can easily appreciate that. Look. 17. Tendons go all the way to the phalanges from 2 to 5, and they do essentially this. Okay? Extensor carpi ulnaris is the last in this row of extensors. You can see it here. And it runs to the 5th metacarpal from the ulna and the humerus. Does that make sense? Obviously, extension. Wrist extension. Now, before we move on, I want to show you how you can go around the forearm. You find brachioradialis, which is 20, and then you go starting with pronator teres, P. Then flexor carpi radialis, F. Then palmaris longus, P. Flexor carpi ulnaris, F. Then you get your extensors. This is ulnaris, ulnar part. So you go with extensor carpi ulnaris, extensor digitorum, extensor carpi radialis brevis, extensor carpi radialis longus. Does that make sense? During the anatomy exam, I'm not going to push you forward. So if you want to go and if you see the muscle of the forearm, and if you want to run the entire sequence in your head, take your time. Do I make sense? I'm not going to say next question. So that is the sequence that really helps. PF, PF, and then 1, 2, 3, 4, 5E. No, sorry, 4E. 1, 2, 3, 4E. This, honestly, is the hardest part probably because there's so many of them with really long names. That makes sense? I don't want to scare. I'm telling you, don't get stuck on the head because that's what many people do. They study head like crazy. They know every little muscle of the facial expression. And then when it comes down to the forearm, what you talking about? Can we move on? Supinator. Deep muscle that connects ulna and humerus to the radius. Now, this one, obviously. Pronator, pronates. Supinator, surprise, surprise, supinates. So you can imagine, I'm not going to ask you what is the function of the muscle supinator. Okay? Abductor, pollicis longus. Abduction of the thumb. So this is the abductor pollicis longus. It's distal, right here, number 15. Oh no, 23. Sorry, I mixed up number. 23 here. That's abductor pollicis longus. Now we're going to talk about individual muscles that regulate movement of the fingers. I'm going to focus less. In the exam, I will pay much less focus to the muscles that move fingers. Did I make myself clear? Extensor pollicis. Well, obviously it extends. So you have extensor pollicis brevis and extensor pollicis longus. Oh, this is the great. Extensor pollicis brevis, okay, and extensor pollicis longus. They all merge, okay. Originated radius and ulna, and they are inserted into the thumb phalanges. This is what they do. When you show this sign, that's extensor pollicis. Extensor indicis. Sort of a unique muscle, okay. You see extensor indicis originates at the ulna, runs to the index finger, and does this. Okay? Okay, I don't want you to get bogged down on these ones. I'm not going to ask about interossei or lumbricals on the exam. Don't worry about it. Just want to give you an idea. So there are a lot of little muscles in the palm. Abductor, flexor, opponents, adductor, everything with pollicis refers to the thumb. And you can sometimes identify. So this is, for all of you, okay, so this is going to be abductor pollicis. Okay? I'm going to pull it out. This is going to be flexor pollicis. Makes sense. Opponents. Opponents pollicis is responsible together with opponent's digiti minimi for this. Okay? So this is opponent's digiti minimi. Okay? Adductor pollicis is a little muscle here. You can see it deep. Okay? This is the adductor pollicis. It brings your abducted thumb back to the palm. Then you have little muscle abductor digiti minimi. If you pull on it, you do this. Flexor digiti minimi, right here. that flexes your pinky, and opponents, which we already mentioned, together with opponent's pollicis, does opposition. Don't beat yourself up about this stuff, I don't want you to spend too much time on this, guys, really. Because that will take away your efforts from, more important muscles. Lumbricals interossei. So lumbrical muscles, there's a lot of little lumbrical muscles. They do flexion at the interphalangeal and metacarpalophalangeal joints. Okay, so these movements. Playing piano, playing guitar, doing all that fine stuff, that's the lumbricals. Does that make sense? Interossei, there are palmar interossei and the dorsal interossei. What do you think they do? Just don't look at the table. So look at this. If I will pull on this guy, what's going to happen? Fingers are going to get closer. Does that make sense? If I will pull on these guys, it spreads the fingers. Does that make sense? I couldn't fit it reasonably on the slide. Just no way. Okay? So we'll have to do something like that. So leg muscles. Again, I'm going to be focusing on what... I have a leg somewhere. Yeah, but somebody stole the... Somebody stole the stand. So we'll have to put it up and down all the time. Okay. When I look at this, I always have an impression when somebody wants to ask me a question. Look at this. Okay. First, I want to remind you about the movements that we're going to be talking about. We're going to be talking about thigh flexion, thigh extension, knee flexion and extension, and dorsiflexion. I think I just pulled a muscle. And plantar flexion. We're also going to be talking about inversion, and eversion, right? Does that make sense? Eversion. Well, I can kind of... No, I can't jump. I'm sorry, I can't get over here. It's just too crowded here. Eversion and inversion of the foot. Okay? And not much about supination and pronation. So we're going to start with the muscles that flex the thigh. Doing this. Okay? There are two muscles, iliacus and psoas major. Okay? Iliacus originate at the iliac crest. Okay, and insert it into the femur. You can't really see the femur here, but trust me. And psoas major originates at the lowermost transverse processes of the lumbar vertebrae. On the leg, you can see psoas major being number 1 and iliacus being number 2. Okay? Can you see that? Iliacus and psoas major. Together, yeah, right there. Together, they are often called iliopsoas. These are primary movers of the thigh flexion. Makes perfect sense, large muscles, okay? And they are attached to the femur, to the lesser trochanter. So if you pull on them, your femur goes up. Sartorius, as I mentioned, my favorite muscle in the human body. Anterior, yeah, the long one, number 10 on the leg right here. The long muscle, okay, originates at the iliac spine and ends the medial proximal tibia, right here. Inserts into the medial proximal tibia. Cool? Sartorius is a weak, yes?
I'm just curious, why is it your favorite muscle?
First of all, because it's the longest muscle of the human body. Second, because during my second year in college, we had, it's a ridiculous reason, but we had weights, like scales, analytical scales. There's a company called Sartorius. For my very long period of my life, I thought it's just the name of the company. Turns out it's the name of the muscle. But it's long and it's straight and it's easy to remember. This is one of the easiest muscles to remember, okay? So since the fibers in these muscles are arranged in a parallel fashion, it is weak muscle. So it assists in flexion, but it also assists in the lateral rotation of the hip. By lateral rotation, what I mean, if you pull on it, your leg will go like this, outward, okay? Lateral rotation. Like if you want to do this type of walk, like Charlie Chaplin walk, you need to rotate your hip laterally. Three big adductor muscles. So I'm going to start with the right-hand side picture here. You can see the very big, very, very big adductor magnus, okay? It originates at the different parts of the pubic bone, the ischial tuberosity, ischial rami and pubic rami, so ischium and pubis, and it inserts all across the femur. This is the very powerful muscle that adducts your leg, okay? Adductor longus and adductor brevis, which originate, so that's adductor longus, there's a little adductor brevis here. They originate the pubis, inserted into so-called linea aspera in the femur. You can see linea aspera in the femur right here. Okay? And that insertion allows to, all of them adduct, primary movers of the thigh adduction. They do participate in the flexion, but they synergists with iliopsoas. Does that make sense? On this leg, you're probably curious, where is what? So number 14 is adductor magnus. Number 13 is adductor longus. Okay? The part of it. 13 is adductor longus. And 12 should be adductor brevis. But 12 is barely visible. Does that make sense? Can you see them? The rather small muscle called pectineus. Huh?
Yeah, no, they were looking like fours. That's what I was like. I was hoping to stick around.
So, a rather small muscle called pectineus is the synergist in the adduction. It is cut on this picture. You can see it a little better here. Okay. Pectineus. So it helps in the adduction of the leg. Okay. Gracilis. Muscle that is fairly easy to remember. Origin is in pubis. Insertion is the medial tibia. You can see gracilis. It goes practically, vertical on the medial aspect of the thigh, number 15. Okay. By the way, you can notice that all adductor muscles, all of them, they originate, at least partially, at the pubis. Does that make sense? They originate at the medial side of the coxal bones. They originate here, and they are attached either to the medial femur or to the medial tibia to bring leg closer. Sure.
Was there a number for the
No, on this one, no. No. Does that make sense? Wait. Now, extensors. Although we have just enough time, and I will tell you, I don't remember if I told you that horrible joke. Okay, extensors. Glutes. Gluteus maximus. Gluteus maximus is 3. Gluteus medius is 4, and gluteus minimus is 5. So in this picture you can see gluteus maximus. That's the buttock muscle. The primary extensor of the thigh. So that muscle that works when you move up from the squat position. Does that make sense? Gluteus medius and gluteus minimus are mainly abductors of the thigh. So medius, that is cut, you can see it right here, and minimus deeper to it. Okay? They all originate the ilium and insert it into the greater trochanter of the humerus. So when you pull in them, they do this. Does that make sense? They do this. Medius and minimus are abductors. Maximus is extensor. Ridiculous story. Maybe I told you that. I don't remember. The guy is the verbal exam in anatomy. He doesn't know anything, just desperate. The professor wants to get rid of him. I can tell you, as the instructor, sometimes you just want the student to pass, especially if you see him like 7th time in your life, trying to pass your course. So professor wants to just ask him one question, if he answers right, he gives him C and just, happy trails. So he has him, okay, one question. If you answer, you get C. Which muscle is primarily responsible for smiling? Well, zygomaticus, right? But the student has no idea. Or you can say risorius, but mostly zygomaticus muscle. Students, somebody from the auditorium whispers very, very quietly, gluteus maximus. Student says, oh, it's gluteus maximus. Professor looks at him, gives him this long, hard, sigh, and tells him, okay, you can go home, you will come back in 2 weeks, and if you can smile with your gluteus maximus, you will get an A. So that's easy to remember. There are a bunch of small muscles that are rotators and abductors of the hip, deep to the gluteus maximus. Muscles like piriformis, obturator, gemellus. Don't worry about those guys. Okay, I will tell you what to worry about. Okay, one specific. So they all rotators and stabilizators of hip joint. Okay, does that make sense? Think about them as rotator cuff muscles, but for the hip. Does that make sense? And you can see they're pretty thick. They're short, thick, so they can produce a lot of power, but that power goes for your hip stabilization when you say lift. And think about this. When you're lifting, what do you injure?
It depends on which you have out of alignment.
Usually it's not hip. Hip is rare.
Your back.
Knees, back, or knees, but usually not hip, because hip is very well stabilized. Another pretty common injury during heavy lifting, especially deadlift.
Abdominal.
Yes, the point of attachment of rectus abdominis to the pubic ramu.
You get the hernia.
Huh?
You get a hernia.
Yeah, you can, and actually it's so that sprain of the tendon that attaches rectus abdominis to the pubic ramu is called sports hernia. It is not a hernia in the traditional sense. Your bowel doesn't protrude, but it hurts in the same place. So if you would press at the pubic ramu and it hurts specifically where you press, then you have sprain of a tendon. Okay? It doesn't require surgery, just rest. Okay. Knee extensors. Now, this is kind of tricky. Muscles that flex the thigh at the same time extend the knee. So they have kind of double function. Does that make sense? Now, the first, so it's a group of muscles that we call quadriceps. The first very noticeable muscle is rectus femoris. Muscle number 11A. Well, 11, okay, for that matter. Rectus femoris has the origin in the pubic bones, and it inserts into the tibia. So that allows it to extend the knee when the thigh is stabilized, or flex the hip when the knee is stabilized. Vastus muscles. Vastus, sorry. Lateralis, 11C. Medialis, 11B. And there's one under rectus femoris. I don't want to disassemble it, please. Vastus intermedius. If you would remove rectus femoris, which I strongly suggest you don't. I mean, you can, but then this whole thing will start falling apart. Under the rectus femoris is vastus intermedius. On the right-hand picture, you can see vastus lateralis, vastus medialis, and vastus intermedius. They all originate at the proximal femur and inserted into the tibial tuberosity. Now these guys, since they run from the femur to the tibia, they can do only extension of the knee. They do not cross the hip joint. They have no role in moving the hip joint. Does that make sense? Tensor fascia latae originates at the iliac crest, and it is inserted into the tendon known as iliotibial spine. You can see tensor fascia latae here on the big one, the big model. I told you it's going to be falling apart. On the big model, tensor fascia latae is number 9. And it is inserted on the big one, into the iliotibial tract, which is number 77. Roll it. It's on the lateral side. Yep, number 9. Okay? Did you find it? So obviously, iliotibial tensor fasciae latae, knee and hip stabilization, and a little bit of abduction of the thigh. One of the very common running injuries is the inflammation of the iliotibial tract. When shoes are not correct and there's an additional pull on iliotibial tract, it may lead to the sprains and damages. Okay. Now, muscles of the posterior thigh, what we call hamstrings, responsible for partially extension of the thigh and flexion of the knee. Does that make sense? If the muscle of the posterior thigh crosses the hip joint, it can extend the hip. And they all cross the knee joint, so they can flex the knee. It can flex the knee. The way I suggest to memorize it, again, it's a biceps. Biceps flexes your elbow, biceps flexes your knee. In this case, it's the biceps femoris. Biceps femoris is the lateral muscle. It carries name 18 here. Okay? Now, how do you know on the model that the muscle is lateral? How do you know that it's outside? Pinky toe, yes. Does that make sense? It looks pretty symmetrical, but if you would look, here's pinky, so this side is lateral. You can also kind of make another association. Iliotibial tract is on the lateral aspect of the leg. By the way, it's not funny, it hurts. No, I know it is. Okay, now, medial muscles, medial hamstring muscles, are semitendinosus and semimembranosus. Picture here doesn't do justice to them. So, semimembranosus, here. It's the superficial muscle. Semitendinosus is deeper. So if you would look at this one, okay, you can see semimembranosus, superficial, 16, and semitendinosus is deep, 17. Does that make sense? Can you see superficial versus deep? Semimembranosus is superficial, semitendinosus runs deeper. All these muscles have origin, the ischial tuberosity. Remember how we discussed that wherever muscle, powerful muscle, is attached to the bone, bone is a protrusion, there you go. Hamstrings attachment is at ischial tuberosity, you have a protrusion. Okay? And they are inserted into the tibia or fibula. Okay? All of them cross two joints. They cross hip joint and the knee joint. So they all are thigh extensors and knee flexors. Does that make sense? Flexors of the ankle. When we say flexors of the ankle, we are talking, remember the rule. If the muscle crosses the joint anteriorly, it flexes or extends. If the muscle crosses the joint anteriorly, it flexes. Does that make sense? If the muscle crosses the joint anteriorly, it flexes. Posteriorly, it extends. So muscles that extend, or think about this, ankle flexion, this, what we call also dorsiflexion. Does that make sense? So muscles that flex or dorsiflex the ankle include tibialis anterior. The origin is the proximal tibia and insertion, tarsals and lateral medial tarsals and metatarsals. Okay? So this will do inversion and dorsiflexion. You can clearly see tibialis anterior. This leg under the number 19, right here. Does that make sense? Then you have a muscle called extensor digitorum longus. It is not very clearly seen. You can see on the left hand side extensor digitorum longus. It is lateral to tibialis anterior. Sorry. It would be actually number 21. Okay, the model. The model is pretty good. It runs to the toes. Fibularis tertius is a rather small muscle, which you won't be able to find in the model. Now look, all of them originate at the tibia, and all of them are inserted into different phalanges or metatarsals, except for the tibialis anterior, which also is inserted in cuneiform. All of them are responsible for dorsiflexion, and some of them are responsible for eversion or inversion. Now, it makes perfect sense if you would look at the picture. Tibialis anterior, with its tendon being inserted on the medial side, will do inversion. Fibularis tertius, with its tendon, let me show you tendon, with its tendon inserted on the lateral side, will do eversion. Extensor hallucis longus. Oh yeah, that's deep muscle that extends your toe. I can't show it to you, okay? But moves your big toe up. And extensor digitorum longus, you won't see it here, moves your toes, rest of your toes up. Lateral leg, fibularis longus and brevis. 22 is fibularis longus, 25 is fibularis brevis. They originate at the fibula as the lateral bone, and they are inserted into the metatarsals 1 and 5. The ligament for the fibularis longus runs under the foot to the metatarsal 1. Okay? Ligament of fibularis brevis is inserted into the metatarsal 5. Here you can see fibularis longus, being superficial to the fibularis brevis. Muscles that plantar flex. Gastrocnemius is the large posterior muscle of the lower leg, which originates in the femur and is inserted into the calcaneus bone. You can clearly see gastrocnemius the lateral side here, that's the medial portion. Okay, so that's gastrocnemius. Over number 24. Okay. And the main function of gastrocnemius is the plantar flexion. Since gastrocnemius crosses both ankle and a knee, it is a synergist for the knee flexion. Soleus is the deep muscle. It does participate in the plantar flexion, originates in the tibia and fibula, so it doesn't cross the knee joint. It does cross the ankle joint there. Soleus is more important in posture rather than in the jumping movement. Jumping movement is mostly gastrocnemius. And plantaris, which runs from the femur to calcaneus. You can see the tendon for plantaris that runs from the distal femur all the way down to calcaneus. It's a weak synergist in both plantar flexion and knee flexion. Deeper muscles, the ones that I want you to focus on, are tibialis posterior, okay? Participates in the knee flexion, runs from the femur to tibia. Flexors, flexor digitorum longus and flexor hallucis longus. Now, you won't be able to see tibialis posterior. Well, you kind of will be, yeah. So this is tibialis posterior 28. Now, flexor digitorum longus is 27. It's kind of counterintuitive. Flexor digitorum longus runs on the medial side, but then its ligament crosses to all the fingers. Flexor hallucis longus, which originates at the fibula and inserts into the phalanges of the big toe, runs, it's 29, it runs closer to the lateral side, but it crosses and goes to the big toe under the foot. Now, as I mentioned before, let me see. Okay, yeah. To give you peace of mind, I am not going to pay too much attention on the exam to the small muscles of the foot, as I will not pay too much attention to the small muscles of the palm. Was I explicit enough? Okay, so general overview, a lot of small muscles, and I will make a case for them actually. So first of all, you've got flexor digitorum brevis. You have longus and you have brevis, okay? They flex your toes. You've got extensor digitorum brevis, okay? Which is, rather small muscle, okay? You can see the ligaments and you see those little muscles right here. Okay, they extend the toes. Hallucis generally, and not generally, hallucis refers to the big toe. So abductor hallucis, the lateral muscle, the medial muscle, will fan out a big toe. Abductor digiti minimi will fan out the pinky. Lumbricals will make, as fine as those movements can be, movements of your toes. Okay? Flexor hallucis will allow you to flex the big toe, and the adductor hallucis, muscle that run across the sole of your foot, will bring the hallux, big toe, back. Okay, right here. It's adductor hallucis. And finally, interossei, plantar and dorsal, they are absolutely matching the function of interossei in the palms. So plantar, interossei right here, they will adduct fingers, in your foot, and dorsal interossei, they will abduct fingers. Spread them out, fan them out. Why I wanted to make a case? You can see that there are a lot of tendons in the foot, in the bottom of the foot. And many of those muscles, they actually maintain the arches of your foot. Does that make sense? Do you understand what I'm saying? So for instance, I'm flat-footed, which means that there's much more tensile force acts on, let's say, adductor hallucis, which acts on the tendons of adductor hallucis. And since it acts, and those muscles, in my case, work much more intense to maintain proper posture, to every time I make a step, they need to contract to provide enough amortization with each step. Does that make sense? They work harder, they pull on the tendons harder, which means that I regularly, and it's true, not that I'm complaining, I regularly experience plantar fasciitis, not to that extent, but the sole of my foot hurts from time to time. People who decide not to go with the proper shoes while running, they may develop plantar fasciitis full-blown. This is the condition that's really hard to treat, because one of the activities that you do every day is walking. It's hard not to walk. One of the treatments for plantar fasciitis is steroids, which are not really good. Okay? So, remember, those muscles, though small, can give you a lot of problems if you don't take care of them properly. Okay, now I'm going to